There's an interesting device that's being touted for weight loss. It locks your jaw shut so you basically can't eat too much except liquid food. But could it work? And is it a good idea for losing weight? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. Let's take a look at these devices, like the Dental Slim Diet Control. Wiring a patient's jaw shut, also known as maxillomandibular fixation or MMF, to prevent them from eating too much is not a new concept. There was a time in the 1970s and 80s that dentists often carried out this procedure to help patients lose weight. By keeping the jaw shut, patients could no longer bite or chew food and had to consume mostly an all-liquid diet on which they would typically lose weight. This unusual use for a dental device was not the only of its kind. In the 2000s, a retainer-like device was marketed to help patients take smaller bites. It would sit in your mouth and take up space, making it awkward to eat and chew food too quickly. Basically, it would take much longer to eat food with this device in your mouth. Some modern devices are not much different than the orthodontic jaw wiring procedure used in the early 1980s, although it uses magnets to hold patients' jaws together rather than wire, and is paired with a specific very low-calorie liquid diet to achieve weight loss. Risks and complications. Having your jaw wired shut poses some distinct problems. There are choking risks if a patient vomits. Eating problems aside, you may find it difficult to talk or clean your teeth properly. You may have difficulties breathing normally if your nose or sinuses block up, or if you have allergies. Things like sneezing and yawning may be uncomfortable. Damage to your teeth from the equipment used to fuse your jaw shut is possible, albeit uncommon. You might also get constipation, as the all-liquid diet you're now forced to go on lacks fiber or bulk for your stools. You may also experience a significant change or decrease in your quality of life, and it might cause significant psychological distress. You see, we take opening and closing our mouth for granted and do it almost as naturally as something like opening and closing our eyes. It's the primary way we carry out essential functions like communicating or consuming food. So by suddenly taking away the ability to do so, may present some challenges some people are not ready to face. This psychological distress should not be underestimated, especially during weight loss, since many people stress eat, and creating a psychologically stressful environment can make it more difficult to follow a healthy weight loss diet or have a good weight loss mindset. Is it a good idea? The device works primarily by forcing compliance to a liquid diet onto patients. Following any low-calorie liquid diet like a juicing fast is effective in helping people lose weight initially, but is rarely sustainable. For many people with their jaw wired shut, some weight loss is achieved, but only temporarily. In fact, studies seem to show that nearly all patients regain weight after removal of such devices. I wouldn't be surprised if a patient gains even more weight afterwards, as the psychological distress created by having their jaw wired shut may trigger stress eating and compensatory consumption of solid foods after being unable to eat them for so long. Should you do it? For long-term weight loss, I'm not sure this would be helpful. The device forces compliance and does not really help you develop good dietary or lifestyle habits. If anything, it creates poor dietary habits since liquids are not usually as filling as proper solid foods like vegetables. If you're thinking about using it to help you temporarily drop to a certain weight, say before a surgery, simply following a very low-calorie diet like a portion-controlled Mediterranean diet would likely be less stressful and far cheaper. However, just because I can't think of any good applications right now doesn't mean it couldn't be helpful. There may be people who find it useful in specific circumstances, but based on all the patient reports, studies, and my experience with different weight loss tools, I find it difficult to recommend in most circumstances. Let me know in the comments down below about what you think about the device. And if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know who can use the help.